Hi, everybody. Welcome. Welcome to the Trauma Research Foundation's first book club. It's been a long time coming. Since we've been online and doing programming, it has been our hope to gather everyone together in this way. My name is Alicia Skye. I'm the CEO and co-founder of the Trauma Research Foundation. And this book right here that I also have bookmarked and tabbed has been in existence, was published in 2014 and has changed hundreds of thousands, perhaps millions of people's lives. And I'm really excited to welcome you to talk about this, converse amongst yourselves, dive deeper into what this book has meant to you and what you've learned from it. I want to especially thank Laura Walsh, our program manager, for pulling this program together. She's done a really phenomenal job. And so I'm going to let Laura introduce our hosts for this event, but also I'd like to give a shout out to our whole team that's here today. Teresa Young, our operations director, Pat Murray, our media manager, Nicole McGee, our development specialist, and if I'm leaving anybody else out, forgive me, but welcome. We're all really happy to have you here. Thanks so much.
Thank you, Alicia. So again, I just want to reiterate how excited we are to kick off our book club today. And thank you to each one of you who's joined us. And for anyone who'll be joining via a recording later. And we have a beautiful group of panelists here that will be joining the discussion as well. So thank you to each one of you. So I just want to take a moment to introduce our book club facilitators, Whitney Yulkinen and Brendan O'Hara. They are TRF community members who have reached out and been involved in other volunteer capacities for the foundation. And we are just so grateful for them, for their time and contribution to this new project. And I'm going to leave you in their capable hands. And I expect we're going to have a wonderful meeting. So thank you all.
Thanks, Laura. And Pat, I'm going to go ahead and share my screen.
So I'll go ahead and introduce myself a little bit. I'm Whitney Yulkinen, and I'm really excited to be here with all of you today and our wonderful panelist group. And I live in Utah. I have a 12-year-old son and my husband and I. And I have worked in anti-trafficking and child anti-trafficking exploitation for the last 7 years. I was introduced to this book about 6 years ago by a friend, Kim Cohen. She's an incredible advocate for sex trafficking survivors and a survivor herself, and she just highly recommended this book to me, which I think speaks volumes when survivors specifically bring books forward and say that it helps them a lot. And I have read it probably 6 times since, so just gained so much from it. And just very helpful in normalizing things that are really tricky to understand. And I'll take a little quote real quick from Bessel. He said in writing this book, he wanted to write it as both a guide and an invitation to dedicate ourselves to facing the reality of trauma, to explore how best to treat it, and to commit ourselves as a society to using every means we have to prevent it. So I'm so grateful to join you and the Trauma Research Foundation to do just that and to create a more trauma-informed society. So.
Thank you. And my name is Brendan O'Hara, the other facilitator. Send it Brendan, which you see right there is actually my Instagram handle. I am an athlete who completes fitness challenges to raise awareness for PTSD and effective treatments like internal family systems and EMDR. I'm also a freelance graphic designer and photographer and writer, working with nonprofit clients like TRF, who I recently wrote a blog post for, and the technology and retail and sports industries. And I learned of trauma-focused therapy and the body keeps the score from a therapist who first recommended the book to me. And I also heard a Tim Ferriss podcast with Dr. Richard Schwartz, the founder of Internal Family Systems Therapy, and they referred to this book in that podcast. And this book has been hugely transformative for me on my journey, and I couldn't be more excited to be part of this discussion. So, so with that, we'll just go through the agenda very quickly. We'll go through the book club guidelines and expectations, some wellness recommendations, then the discussion itself, and then check-ins at the very end, and then we will close.
I'd also, can I jump in real quick? Just wanted to introduce the panel to everyone here. And if we would love if you wanted to subscribe to the YouTube channel, then you can comment in the comment section of the YouTube. And if you'd like to introduce yourself as book club members on YouTube on the comment section, that would be wonderful. We'd love to hear from you. Your name, where you're from, and maybe one word that describes how you're feeling right now. And as well, I would like to invite the panelists to do the same, either in the Zoom chat or on the YouTube live as well. So thanks so much.
Great, thanks, Whitney. So we will, just to run over some guidelines and expectations for our discussion. Let's see, go back here. And,
Oh, okay, sorry. So
that's okay, Whitney.
yeah, I'll start off by going over a little bit of these guidelines. So these are just some things we can do as members of the book club to participate. So there is the chat, which I already mentioned, and then there's also a book club app that you can download where you can ask questions or have discussions there as well. If you're interested in participating on our panel, please find the link to the book club panelist questionnaire. We will put that in the chat on the YouTube channel, and it's also in your welcome email that you had received when you registered for the book club. And each week we will select about 15 to 20 people to who have completed that questionnaire to participate in our discussion. And just some additional guidelines: please be gracious with differing opinions. Please take space and leave space for others. Panelists, just a reminder that each share, please try to keep to about 2 minutes. And however you're able to participate, please stay on topic. Each week we will be discussing sections of the book, and we'll be asking a series of questions for the panel to discuss. This week we'll be discussing section 1, which consists of chapter 1 through 3. And we'll be asking a series of questions to the panel. And thank you for submitting any questions. If you did that, we can't get to all of them, but we will certainly try to get to as many as we can. And yeah, that's about it. So I'll hand it over to Brendan.
Thanks, Whitney. So just to run over the book club schedule, we'll be offering 4 books to read per year. Each book will consist roughly 4 to 6 weeks of virtual discussion groups, with the final week being a discussion with the book's author. And today we're here discussing The Body Keeps the Score by Dr. Bessel van der Kolk. And as Whitney mentioned, we'll be discussing chapters 1 through 3. In part 1, the rediscovery of trauma. So Whitney?
Yep, so it's just some wellness recommendations to go over. There will be possibly some triggering content, so please be aware of that. And some of these topics are difficult. Please feel free to take a pause if you need, and be sure to take care of yourself as the panelists and the group members, book club members that are viewing on YouTube Live. And a couple recommendations you can do if you're feeling triggered or feeling triggered, you can take a pause, get a drink of water, stretch, or do deep breathing. Another one is naming your 5 senses, can also help kind of ground you back.
Okay, great. Thanks, Whitney. So without further ado, let's start with the discussion. And our first discussion question is, what messages about the potential for healing from trauma resonated the most deeply with you? And we'll open that question up to the panel. And if anybody would like to virtually raise their hand.
I see a few there.
How about Linda, you have your hand raised.
Okay, yes, thank you. I think what makes me most excited about healing is the looking at the 2 different sides of the brain and how we can always rely on the left side to tell the story as best it can, but it can't tell that story unless it can talk to the right side. And the right side in deep trauma is just a conglomerate of emotions that can be triggered by something that's totally related to the original trauma. So what's hopeful is there are methods to pull you out of the past such that your life isn't such that all your feelings and emotions aren't grounded in the past, and you are able to put that thing together as a story with a beginning, middle, and end, because we're a storied people, and if we can't tell our story, we can't be present.
Absolutely. Thank you, Linda. Joanne, you have your hand raised. Oh, I think you're still on mute, Joanne. Thank you.
Yeah, I resonated with that comment because I remember in the book, there's a passage that says that images of past trauma activate the right hemisphere of the brain and deactivate the left. And that has implications for how we take care of ourselves. For example, in doing yoga, doing poses to the right or to the left. It has implications for yogic breathing practices and also for Tai Chi and Qigong. So that information can be applied to our, our practices to keep us healthy and balanced.
Thank you, Joanne. Frederick, you have your hand raised also.
Yes, thank you. I also resonate with all the comments, but the one that I truly feel I just felt so touched by was on page 38, and it was this statement. It was, our capacity to destroy one another is matched by our capacity to heal one another. Restoring relationships and community is central to our well-being. And I thought that is such, we often think of what's wrong with us, what is lost, but also what can be right with us through the work of collective community and awareness. And I thought that was such a beautiful, hopeful statement to say, let's also know that there's power in restoration and growth possibility in the collective work of people who are aware and are skilled. So I think that is something that I truly took away from this.
Excellent. Thank you, Frederick. I think we have time for one more response. Wendy, you have your hand raised. Wendy Tucker.
Yes, I'm from West Virginia, but I think what resonated with me was just the fits and starts. Like, one of the very first examples in the book was with the veteran that was having nightmares, and Bessel wanted to resolve the nightmares, and then found out that the man really wanted to keep the memory of his friends alive. And so I think one of the things that struck me was just how it's a continuous process. Like, you run into one dead end, but there's another way of healing. And I think that's what was very helpful to me about, sometimes it is medication, sometimes it is EMDR, sometimes it is yoga, sometimes it's, it can be lots of different things. But I think the most impressive statement that I read was numbered, it's on page 9, but he says, reassured by my obvious interest, Tom settled down to tell me just how scared and confused he was. And I just felt like that was such a profound, the potential for healing is when you realize, I think, that someone is deeply interested. And that's what makes that connection possible, because every person's trauma is different. Every healing modality is different. But when somebody's deeply listening, they also allow the person recovering from the trauma to participate. And I just felt like that was, that's the potential for healing for me, is that deep listening and, okay, that didn't work so well. All right. And I think just the method of Bessel's research is over and over and over. And, those darn dogs that had to be dragged out of the cages, I just had to appreciate that learned helplessness. Like, they couldn't do it. They had to be dragged out of the cages. And so you talk about potential from healing. It can come from so many, so many different ways. And I think that was very, very positive and very helpful to me.
Thank you for sharing, Wendy. Let's go to the YouTube chat and see what some folks are submitting through the YouTube chat. User Savvy Cupcake comment is, in chapter 2, there's a discussion of mediation usage bringing people back to the present. How do we know when a medication will help propel us forward and when it will be detrimental? That's a very good question. Whitney, did you have any insight? Or
let's see, on how do we know when a medication will help propel us forward and when it will be detrimental? Yeah. I think similar to what Wendy was saying is that, different things will help at different times for different people. And you kind of just have to keep moving forward and trying different modalities. And there's a lot of hope out there for different things. But I'd be curious if anyone else has any comments on that.
Linda, you have your hand raised.
Oh, you're muted, I think. Sorry.
From my experience, it's a really good question. And I personally started taking antidepressants in 1985. And I remember when it wasn't working, a GP who's otherwise a really good doctor, he held up a list of antidepressants and he said, pick one, any one. Oh. Which caused me to go to a psychiatrist because I thought I need a specialist. And there's a lot of conflicting facts about that question, because it says that antidepressants in the book on page 28, it says antipsychotic drugs are a factor in greatly reducing the number of people in mental hospitals. And yet on page 37, it says that if there is SSRIs, antidepressants, are as effective as we've been led to believe, depression by now would have been a minor issue in society, but that's not the case. It's depression has increased. So it's a really good question that's hard to answer from my perspective.
Absolutely. Okay. Whitney, should we move on to question number 2?
Yes, yeah, just for time.
Sure.
Okay, so question 2 is, in talking about the case of Bill, Vanderkolk paraphrases a quote from Freud. I believe this man is suffering from memories. Oftentimes trauma symptoms are mistaken for other mental health conditions. How do you think the fields of counseling and psychiatry can better prevent these harmful mistakes from continuing to occur? And Jennifer, please. See your hand raised.
Yeah, thanks. I actually wanted to tie this in a little bit to what Linda was just sharing, because I really picked up on that quote too. I'm here in Canada, and I've been an educator for 20 years, and I'm a foster parent. And I see a lot of kids being heavily medicated. And while I'm not against the use of medications, and they definitely can help support in the healing process, I am concerned that we don't seem to be bringing in other sort of grounded, embodied, earth-based traditions. I work with a lot of Indigenous kids who, you know, in their cultures, storytelling, songs, drumming, ceremony, these things are all used to help transmute trauma. And I think this is kind of what's missing, where we don't really have a very good mix of, you know, like the allopathic medicine pathway working with these other more embodied traditions. I think they go very well together. And so, and also the other piece is, I just don't think people really understand what trauma looks like and how it works and how prevalent it is. So one of the things that I think makes me more effective as an educator and as a foster parent is I too experienced early childhood trauma, and my entire adult life has been about, you know, healing and finding ways to heal. And so I think that until we can actually start identifying what it looks like and what it why it's so important for us to focus on trauma healing as a society and how it's connected to the way we govern, the way we educate, the way we try to help people to heal, I think it's going to be a very hard bridge.
I think that's so true. We have to look at systems and how it impacts our relationships too. Holly, I see your hand.
Hi, I'm Holly Elisa from Massachusetts, and I'm really glad to be with you. I want to tell you that I'm from the perfect family. I want to see if anybody else wants to say you're from the perfect family. Yeah, that's what I was told growing up. In fact, I am an incest survivor. In fact, I am an abuse survivor, so much that I was blacked out by the violence in my family. And yet my family persisted in saying everything was fine and nothing hurt at all, to quote Vonnegut. And the question, how do you think fields of counseling and psychiatry can prevent troubles from coming up? Honestly, I am very touched by the fact that several therapists are now claiming their own trauma. I was listening to Bessel van der Kolk himself speak, and he said, we're all patients, we're all clients. So what I think is most important is to drop the cover story that psychiatrists and psychologists have to be perfect, and to instead own our own stories. As I'm owning mine, I'm a recovering attorney. Trust me, to reveal any vulnerability would have been totally anathema in my profession. And I'm 76 years old, so I was one of the few women that were attorneys at the time. I had to present myself as invulnerable. The truth is, my life is anything but perfect. My family was anything but perfect. And so I welcome people in the field who are able to say, come talk with me. We're all in this together. Yes, I can be a guide. Yes, I can be helpful, but I'm not finished either. I'm not finished either. And I'll end by saying that when I was first connected with, actually, here's a story I had from when I'm 17 years old. I'm in college and I'm having anxiety and panic attacks during exams. And I went to the infirmary, to the psychiatrist there, and I said, I'm really having trouble. And he looked at me and asked me a few questions and said, you're highly functioning. I see no reason to treat you. What I was doing was presenting myself as a person who was all together, whereas inside I was falling apart. I was falling apart. My mother was psychotic, and that's what I had grown up with, taking care of her. And I needed someone to see beyond the perfection that I was presenting. So yes, I think the truth can set us free on this one. Thank you.
Thank you for sharing. Gail, I see your hand.
Thank you. Yes, from Nova Scotia, Canada. I wonder if the answer really is the title of the book and everything that Bessel invites us to think about from a whole systems perspective. if we think about the individual as a system and more than just what's available to us from the neck up. We think about the family as a system, we think about the community as a system, and we think about all of us together as a system. And that, and in terms of the social determinants of health, everybody who has a part in our education, our justice systems, our health systems, all of that coming together to really change the narrative, to start to use different language, to be sensitive to when we start to talk to people about this whole being and the integration of this whole being, the ability to regulate our own physiology, including some of the so-called involuntary functions of the body and the brain, and all of the social conditions to create the environments where we can thrive. I think part of the invitation here is to move it out beyond the fields of counseling and psychiatry into our whole systems and start to really examine our touch points and where can we as individuals start to make a difference, invite different language, invite different conversation so that we can start to really make a difference for us and the generations that will follow us. I wonder if that's the invitation.
Great points, thank you. Angeles? Oh, you're on mute, I think. Thank you.
Hi, my name is Angeles, and I'm coming from Hawaii. And this question's interesting because I think I used to do research, and a lot of times you'll find answers according to the question you ask. And in this question, it says memories, and memories to me is like stories and past and present. And when he says oftentimes trauma symptoms are mistaken for other mental, he's saying mental, and a lot of times I think that's the whole mind. And in yoga therapy, my meditation practices, the mind is not separate from the body. The mind is the body, and memories are symptoms of the whole body. So I really think addressing holistically, like I teach yoga therapy, so I'm going to be influenced by that experience, those experiences. But I think what's amazing about yoga therapy is that they involve a lot of different parts of a human experience. And in the book, I noticed how Van der Kolk talked about diagnoses and how important that is, but not as important as one of his teachers looked at the whole human being. And I think the more we can treat people as beings versus diagnosing something, like creating a story about something, I think the more we can address trauma, because trauma is not memories, just memories to me. It's not just a story, it's
Yeah, thank you so much. I think we may have to move on to the next question here, but I wanted to share one comment from the YouTube live, and as well as mention that please, there's a wonderful discussions going on there, so please feel free to comment any thoughts you have on those lives with each other, and because we won't quite have time to get to all the comments, but looks like Dr. Eileen Beyer-Curry said, sometimes medications can be used preventatively in the aftermath of acute trauma and with PTSD to help people not dread sleep, get rest, and have the energy/hope to use mind-body tools. I think that's a really good point. And then, yeah, go ahead, Brendan, with the next question, if you could.
Sure. Before we moved on, did anybody else, we do have a little bit more time. We're progressing pretty quickly through the presentation. So if there's anybody who wanted to chime in and on discussion question 2, anybody else?
Joanna, yeah, please go ahead. Great.
Okay, I thought I should mention that I have been a psychotherapist for many years, as well as a yoga therapist. And I think one of the major messages that I took from these chapters is Dr. Van der Kolk realizing that the person, it's more important to pay attention to the person and to see them, as a unique being than it is to label them. So the label can be useful, but I think it's a secondary kind of tool. And with that shift, I think there'd be a lot less mistakes in dealing with mental health issues.
Yeah.
And also, I think basically, I would say that's true for medication too, is that it's not, it's useful, but it's not necessarily the answer. And I think that it's more important to really be present with someone and care about them.
I agree. Linda, I see your hand raised.
I 100% agree with Joanne, and it reminded me of a part of the book where Bessel van der Kolk said that he was a student and he asked his teachers, what do I call this person, ADHD or PTSD? And the answer was, you call them Michael Jones.
Yeah, I love that so much. Susan, do you have some thoughts on that?
As a psychotherapist, I always try to remember that you start where the person is, where they are, not where you think they should be or where you hope they are so they fit into the DSM-5. And thinking about medication or any intervention, it's always important to return to the person. And what is that like for you? That they are your frame of reference. That's what I always try to do as a psychotherapist. That's not to say I always do it, but it's a frame of reference for me.
Through empathy and sitting with and listening to seek understanding. Yeah. Wendy?
Yeah, I was just thinking of how frequently he listened to people telling their stories when there had been assaults or there had been other kind of things, and a lot of times practitioners may not ask, because I don't think that's the presenting problem. I don't think often people come in with a big trauma or even an overt trauma. I mean, they come in with addictions or eating disorders, and they get diagnosed with borderline personality, but they really don't. And I think the asking, I just think is critical. I don't know how you encourage people to ask, but to really ask what happened to you, and not make it a problem of willpower or failure or you're resistant or all those other things can just be so demoralizing for the patient or the client when they don't feel free or safe to talk about what happened to them, and so they tend to take the blame again for not getting well, like it's my fault they can't get well. So I just think that the asking and the really listening for what's behind or under, as somebody else has said, is so important. And using the ACEs, the screening for ACEs, I think could be real helpful of just finding out what happened to you. I mean, that should just almost be a given as part of an intake,
right.
I think.
Yeah, I think that's such a key question, what happened to you, instead of a question that places more blame on others. So great, thank you for sharing.
Whitney, I think we have time for one more answer on this question.
Okay, great. Frederick, would you like to comment?
I think people really covered so much of this question. One of the things that I really, when I was reflecting on what made this book stand out to me, I think one of the key parts of this book is the ability to be so curious, to have this this overwhelming curiosity to wonder about the things that you're noticing and not noticing, and like what could it mean, and for them, for the person, for like just really this curiosity. And that's one of the things I think as a clinician or a person, the ability to be curious, not in a voyeur sense of curiosity, but a very compassionate and open curiosity. And then with that curiosity, you also have the ability to just notice and pay attention. And I think that is what's very different in terms of the practice of trying to help someone heal, is the ability not to see them as you're only in for 45 minutes or 30 minutes, but the ability to be fully present with them and to be able to really join with them to explore whatever they're troubled about without judgment, without trying to put them in boxes. And through that process, I think you come to an awareness and you come to some type of support. And I think that's the big idea that I've taken from this book. So I just, this curiosity and compassion and noticing.
Thank you so much. Yeah, great share.
Thank you, Frederick. Okay, moving on to question 3. What thoughts do you have about traumatic reenactments and the purpose they may serve for trauma survivors? Susan, I see you have your hand up.
I didn't realize I had my hand up, but I'll have my hand up. In reading that question, I was reminded of Francine Shapiro. And for those who have been trained in the EMDR or who have experienced it, a central part of inquiring about what the person's experienced is to ask what is a negative belief about yourself that's connected with that trauma. And I thought of that when I read this question, because in some sense, that is what people encounter in my experience, and I'm sure in other people's experience as well, that it is that negative belief about themselves that kind of sits there and in some way is connected to traumatic reenactment, I suspect. That was my sense in reading the book, that in some sense it is that negative belief that a traumatic reenactment is engaging in some way. So I'd be interested to hear what other people think about that too.
Absolutely. Wendy, what do you think about that?
At first I didn't like the question. It was like, what? But when he was explaining about the role of thrill seeking and the role of endorphins in the brain, like when you first do skydiving, it's scary, you don't like it, but then it becomes exciting and pleasurable. And so sometimes people get used to that feeling of pleasure and they keep doing that risk behavior to keep those endorphins going. And then when they stop doing that, they begin to crave it. So the reenactment is kind of a hormonal way of getting endorphins, pleasure, kind of feel good things. I think I'm getting that right. And the other thing I thought, under that, I think a lot of people reenact without realizing that they do it, but the reenactments are kind of like an in your face, like, you're not getting this. You're still acting helpless. You're still, and in every relationship, you repeat the same dynamic. And then at some point you go, oh, wait a minute, I'm still acting helpless. Wait, what's going on? And it's kind of a funky way of having to look at what's going on in your life and what are you doing and why do you keep picking the same kind of abusive man or whatever the repeating patterns are. And I think that the reenactments are a way for the trauma not to go away so that you almost have to deal with it. Like if you're constantly, getting drunk to avoid something, then at some point you may say, wait, why am I doing this? And I think it can lead you towards treatment. Just my thoughts that, there you go. It's just my thoughts.
Absolutely, Wendy. Yeah, I agree. just in my sort of anecdotal experience, having some traumatic reenactments has really given me a perspective shift and offered my perspective, or offered my therapist windows into what we should possibly focus on, what our treatment should be geared towards. So Holly, I see you have your hand raised also.
Yeah, I want to be really clear. As a trauma survivor, for me, the whole point is choice. If I choose to self-medicate with drugs or alcohol, or in my case, I chose process addictions, I chose achievement, I chose getting all kinds of accolades. Once I caught on that I was reenacting the old internal drugstore of getting my endorphins pumped up by that. And once I caught on that there were choices, that I didn't have to self-medicate by taking myself back to the scene of the crime emotionally, what I got was this: safety. Safety is crucial. So to answer your question, what thought do I have about traumatic reenactment? I have found, as a recovering trauma survivor, that the most important thing I can have as a client is safety. And what does that mean? That means if I choose, as I have, I've been, for example, to the Trauma Institute, Child Trauma Institute in Northampton for a week, and I chose to go back and revisit impossible, at one point in my life, impossible memories. And yet I was with a person who was safe. I was in a process called progressive counting that was safe. And I slowly learned to hear my own voice inside. And my voice inside would say to me, "Sweetie, take a break. This is too hard right now. Take a break." And I could say that to the counselor who was working with me. Or I could say, "Okay, I'm exhausted, but I also know that I'm getting really close to something that matters." So I want to say that before I got into all the healing about trauma, when there wasn't much help out there for trauma survivors, when in fact, and I want to say this, I love and I'm passionate about Bessel van der Kolk saying, the real war is at home. We can read about PTSD and shell shock, but the real war is at home. I am just one of many people who was abused by the people who brought her up. And for me, what's most important is learning where the safe treatment possibilities are, learning if a counselor is safe and well-versed. I actually interview counselors before I choose to have one. I seek them out to find out who has a supervisor of his or her own. I'm not going to see someone that doesn't have that. So I just want to conclude by saying, in terms of reenactments, they are very powerful and can be very helpful to my healing. As long as I'm choosing them, I'm choosing a safe environment with a safe person. And here's the last thing. As long as shame is not allowed to overtake me. Shame and reenactments come so closely together that I think a counselor and the client need to be very mindful and thoughtful about when shame starts to come in and I start blaming myself, it's all my fault. How can I get help with that in the moment? Does that make sense?
Absolutely. Yeah. Thank you, Holly, for sharing that. I think that's such a powerful point, that being able to be in an environment where we're sort of able to reenact a past traumatic event, but being in a safe environment and where shame is not in the equation really creates a juxtaposition between the present and the past. And I think, at least anecdotally for me, that's what has allowed me to leave some of those traumatic events in the past and move on. So yeah, powerful point. Thank you, Holly. And Tamra, I see you have your hand raised.
Hi, yes. Tamra Basir. I live in Gloucester, Massachusetts. And I really resonated with what Holly said about shame. I know that's such a dangerous thing for all of us to get past. And also the chapters that we read where they were talking about Freud and the reenactments are an unconscious attempt to gain control over a painful situation, because I was out of control of everything, my traumatic events that happened, and I feel like I'm just trying to gain control, and that's sort of impossible. Of course, you don't really have control over anything, and that's a scary thought too. So for the reenactments, I can see where you would go back to that and get a little bit addicted to it in a way, and stay in that bad space because you're afraid to move on.
Absolutely. Yeah, Tamra, thank you for your feedback, and let's move on to the YouTube chat just to check in with what comments we might have on the live YouTube chat. And just for those on the YouTube chat, in order to comment during the YouTube chat, you must click on the subscribe button first. So Diane Reese had a question. She says, I wonder if they are going to discuss the lack of access to care right now. Took me 15 months to find a trauma therapist, and I have to pay cash. Thank you, Diane. And that resonates with me as well. And I think that's a fantastic question. We can open up the discussion for that really quickly. If anybody would like to comment. Wendy, I see you have your hand raised. And still on mute, Wendy. There you go. Oh.
I think you're still on mute, sorry.
Still on mute, Wendy.
I just forgot to put my hand down. I'll let somebody else answer that one. Sorry about that.
All right, that's quite all right. Okay, Linda?
I could throw in there that spiritual directors often work on a sliding scale, and the spiritual directors will define themselves. For as many spiritual directors there's that many definitions of what they are, but I think they would all agree on they are helping you to see where God, or whatever you want to call God, loving energy is working in your life, and they're trained to be effective listeners.
Okay, thank you, Linda. That's all the time we have for question 3. Unfortunately, we have to move on. So moving on to question 4, Whitney, I'll pass this on to you.
Okay, thank you. So question 4 is, and I'll read it twice. Given what you know about flashbacks, why wouldn't repeatedly talking about a traumatic experience resolve symptoms? Again, it's given what you know about flashbacks, why wouldn't repeatedly talking about a traumatic experience resolve symptoms? Any thoughts on that? Oh, I see Angeles.
Well, I can only speak of my personal experience with this, is that I found when I spoke about my stories a long time ago with therapy, it was not at all helpful. And so it just made me more, it wasn't helpful. So what I found to be helpful was doing a lot of indigenous practices, a lot of yoga therapy to be in the body, to start creating a home inside my body before I was to discuss those stories. And I actually found it was more helpful to see a movement therapist versus a psychiatrist 10 years ago, more than 10 years ago. So, and that was helpful because it helped me just find ways to be in my body, have fun, be curious, and then things would just come up. And then I would find ways to self-regulate with those stories. And I keep hearing in a lot of the questions, thoughts, like, what is your thoughts? And I honestly feel from my experience is that it's not just your thoughts, it's your body. How can you be really, really sensitive and attuned and intimate with your own internal body system. And I think the questions are misguided, guiding our research, is misguiding practitioners and what to look for. And the more we can, I don't even know if the word articulate is the right word, but the more we can attuned from a nonverbal way with healing, I think we will be able to connect and heal collectively as society, because there's a lot of things that physiologically is happening that's bringing up the stories that are connected to that resonance of a story. And in this book, in the first 3 chapters, he talked about how a lot of people created, like the veterans, when they wanted to heal, they made him into one of them. And I think part of that is to create a home, a collective home. And stories for a lot of therapists who went to school for a really long time, it's a home for them. But what is a home to other people who aren't intellectual academics? What is a home for somebody who hasn't been educated past, high school? What are they going to resonate with? So, and yeah.
Oh, sorry. Yeah, I like that, finding that safety within yourself through different means, and I think that's really important to acknowledge. Thank you for that share. Linda, I see you.
I think I love what Angela said, finding a home in your body, and I'd like to add that what we're doing is remembering our body, the home in our body before trauma got stuck there into our muscles and our very fiber. And I think Susan's pearl of wisdom, that it helps to remember and to forgive yourself for not honoring yourself. I think that's a way through telling that trauma story. And I think if you're asked to tell that trauma story over and over, it just, without any insight in how you can help yourself, it just, it brings the shame in without any release for the shame. It doesn't get unstuck unless you keep getting more insights, so that's what I wanted to say.
Yeah, it makes sense to also work on becoming attuned with yourself and your body, and then talking about the trauma can often be re-triggering. And I had a professor once who said it depends where you're talking from. If you're in your survival response and your activated nervous system, that's likely to re-trigger a lot more versus being able to be more in your executive functioning that EMDR often kind of helps with, so that you're kind of looking down in instead of right in the middle of that trauma and reliving it. So Holly, I see your hand raised.
Yeah, I'm really glad to talk now because I'm paying attention to my body and my palms are sweating. And I'm feeling anxious, and this is useful information. Why? Because what I did with my life was to become as intellectual as I could. Both of my sisters and I, we all got PhDs and JDs and all this stuff because we felt safer when we could be in our mind. What I have learned as a trauma recovering person is twofold. One, I need to be in connection with other people that are safe and other people that are understanding. So if I were to ask a small child who is traumatized, and they are traumatized all over the place right now by the pandemic, oh my God. If I were to be with a small child who was going through a hard time, I would be with that small child, not talking to the child or telling the child something. I would be listening to the child. And what does that reveal? And I've done this. And what does it reveal? That trauma survivors like me need to feel heard, need to feel seen, need to feel believed, and need to feel like there's hope. By the way, I think someone else has got it's not muted because there's noise in the background. But with those 4 points, I'm feeling like the major point about going through a flashback is I'm going to use the flashback in a way that helps me recover. And so what does that mean? I am going to have help bringing my true self, my adult self, into the moment. And this doesn't have to be an intellectual process with people with PhDs and all of that stuff. I go to trauma survivors 12-step groups, trauma-informed 12-step groups. And then weekly, 5 times a week, I talk about my experience. And sometimes I cry and sometimes I'm angry, but I'm telling the truth. And here's something that helps. Listening to other people who have been incest survivors, listening to other people who were not seen or heard, who were beaten, listening to other people who were dismissed, all helps me realize I'm not alone in this. And I'll conclude by saying that Bessel van der Kolk gives me great hope because he connects me through his writing and through his speaking to the whole world of us. Look, all 500 of us here today, we've all got some kind of personal relationship with trauma. It's that connecting with other people, feeling heard, and feeling like I'm not being seen as crazy, which also happened for much of my life as the identified patient. All of those things help. And then I can feel safe going back to those horrible memories and safe that I'm not going to be overwhelmed by shame.
Oh, Whitney, you're on mute.
Oh, I'm sorry. Great. I had said great thoughts, Holly. Thank you for sharing. And I'm going to go ahead and read some of the comments from the YouTube channel. And then if we have time, call on a couple more, 1 or 2 more panelists. So one comment is on page 38. Mary Simmerling mentioned on page 38, talks about the power of language to change ourselves, share our experiences, and find a common sense of meaning. By being connected as a community, we are able to have that sense of belonging, which I think ties so well into what Holly was saying. Rachel Torrey says talking is only part of the treatment process, could be re-traumatizing and fuel disassociation. Very, very good point. Carrie Gorino says, because talking about the trauma is a verbal activity, according to Bessel, all trauma is pre-verbal. There are no words. Very, very good point there too. Okay, and it looks like we do have a couple of minutes for additional comments. So Tomra, would you like?
Hi. Yes, I found repeatedly talking about the trauma to be just so isolating because I just felt you just feel like no one understands. I lost my father, he was bipolar to suicide, and my brother in a plane accident. And these are just 2 sudden deaths, and the combination of them just really makes you feel like no one else could understand that. And that's just so isolating. So I think that connecting to the self has been so important. Mindfulness takes a long time before it works, I think, but if you keep at it, you can reconnect. Connection is so important to others, but first I think you have to connect to yourself and to ground yourself in the present. Mindfulness can really just bring you back to right here, right now, but it takes a lot of practice. So the therapists that I've worked with over the years never really understood. I felt like they were always looking for symptoms, and having a bipolar parent, they're looking for those big sort of symptoms from me, and I don't really have any suicidal ideation or anything like that. So I think that just being able to connect to myself and find someone that can really work with the trauma. I haven't really found that yet. I still don't. I resonated with the person looking for access to care and that sort of thing. So it's difficult, but if you keep at it, it will work.
Yeah. Thank you so much. That's great thoughts and points. And Brendan, I'll pass it over to you for the next question. I think you're on mute.
Thank you. Thank you, Whitney. Discussion question 5. Despite the fact that it is a book about trauma, there is a fundamental hopefulness about the book. What messages did you find most helpful? And I'll read that one more time. Despite the fact that it's a book about trauma, there's a fundamental hopefulness about the book. What messages do you find most helpful? And Angeles? You're on mute, Angeles.
Okay, hi. So some of the things that I found helpful was that him recognizing errors in the way we've been treating trauma, and that there's potential for a lot of help, more help, as they figure out that different modalities and factors can really help people at different times, different ways. The other part is, what was it? No, I forgot. So the other part that I really liked about the book was that it's, I'm sorry, I had the thought. So yeah, I think that him being hopeful that there's more factors out there. And the one thing that I feel when I read the book, that I felt like he was open to feedback. Like even like his own view could be, what's the word? Question too, like how he learned from his own patients, how he learned to reorganize his thoughts about how people can be helped. And I think that ability to be curious, as Frederick's talked about, is so important when you're helping someone. You have to be curious. I feel like you have to be, there's potential for attunement. And attunement to me is a huge factor in addressing the present moment. And that's where trauma is needing to be, is to be here versus in the past. So
Absolutely.
Thank you.
Absolutely. Thank you, Angeles. Holly, I see you have your hand raised also.
Yeah, and I was just going through one of those things that happens to me, that happens to trauma survivors. My mind went flat. It just went kersplat. That happens a lot. And so what I'm doing is just relying upon the tools that I've used and learned as a trauma survivor to answer this question. The thing that there are two things that give me great hope about this book. One is it is telling the truth. And the truth does set me free. And here's what I love about telling the truth. When I read the section that said, textbooks back in the day used to say that incest, not a big deal. Father could do that. In fact, there was even a book that said that therapists can have sexual relationships with their clients, and that was okay. It was like a learning experience. Thank God for the Me Too movement, and thank God for Bessel's book, because there is hope now that nobody who's trauma informed is going to think that something like incest is going to be helpful. OMG, the years that trauma survivors and incest survivors have wasted, have lost on blaming ourselves, that's not hopeful. What's hopeful is that Bessel is partnering with us. I see him as a fellow traveler, not so much as a person that's telling us what to do, but as a fellow traveler. He is saying, look, I am awestruck by what people are saying. I'm amazed that you all could live through your lives given what you have experienced. And it's a privilege to work with you. That is such a powerful statement for me. I feel like, and I'll conclude with this, I feel like we are all in this together. Some folk have degrees in psychology, some folk have all these other skills, but the thing is, trauma is the great equalizer. It is the great equalizer. And the pain of trauma can get us stuck. I was stuck. And the hopefulness is from no longer feeling, I have to stay stuck. Thank you.
Holly, I think that's a fantastic point, that there's hope in, after reading this book, almost that you get a sense that you can sort of see the horizon, whereas possibly maybe before that horizon was blocked by something called trauma. Wendy, I see you have your hand raised also.
Yeah, I was thinking about what I like is that you don't feel crazy, and there don't seem to be dead ends. Like we were talking a little bit about and just knowing how the brain works. It's again, it's not that thing that there's something wrong with you, but when they talked about the left brain shuts off and the right brain lights up, and sometimes there are no words, and so much of therapy now is based on cognitive behavior and things like that, which has a place. But he was talking about, again, so much trauma may be pre-verbal or without verbal, or people may not have memories that are coherent. They may have emotion, sense, fragments, things that you can't put into words. And so the fact that he found lots of different modalities of working with not just the mouth and the head and the thoughts, but all of you was immensely helpful. I think the main thing was that it's not a death sentence. I mean, it's and even if it's hard, there's still a lot of things you can do that make your life qualitatively much, much better. And I think the biggest thing is just not that you don't feel crazy, you don't feel alone, that there's a reason your body's doing this. It's not a failure of will, but that the trauma has a wisdom. The body has a wisdom that is keeping you safe, it's keeping you protected. But a lot of times I think the message of hope is more of listening and, okay, what's going on, rather than lock you up and put you away. I guess that was the biggest hopefulness I found, is just the reality of how the body works, how the brain works, and that you can really trust that. And then when you have your partners to work with you, you've got a way forward.
Thanks, Wendy. I could really relate to that. The portion of the book where he talks about neuroplasticity and our brain's ability to heal itself through these methods, I just found incredibly intriguing and hopeful. Susan, you had your hand raised also. Susan, you're still on mute. There you go.
One of the things that I love about this book is permission to question the status quo. I really, the letter that he got from the Veterans Administration when he had applied for a grant or was looking for a special program, establishing a program within the VA, and the letter said, the post-traumatic stress has never been shown to be relevant to the mission of the Veterans Administration. Now, you have to remember, this is someone who was working there, was part of that system, in many different situations, asking questions about the status quo and what's being ignored, who's being excluded, who's being left out. I also want to make another comment about, and I, of course, very much appreciate the array of strategies to bring the body, the whole body, into the process of healing, which things like the DSM-5, he very freely suggests exclude. As we think about, for example, mindfulness, I think it's very important that whether it's yoga, whether it's mindfulness, whatever body-oriented therapy it might be, it's very important that it be accessible to people, both in the sense that it's available, like someone does it, but also that it's mindfulness doesn't have, in my view, I've been a meditator since 1990. It does not have to be kind of arcane in any way. there are lots of mindfulness techniques that we can share with people. Accessibility and asking questions, it strikes me, are two of the really hopeful things about this book.
Thank you,
Thank
Susan.
you.
Thank you, Susan. And let's check in with the YouTube chat, the live chat. Healing Companions says, I highly recommend getting educated about the polyvagal theory by Stephen Porges. And Carrie Gorenal, think how Bessel described the evolution of the field of psychiatry and then evolving neuroscience, that incorporating body work will be a natural step in that evolution. And yeah, that's a great comment, sort of dovetailing off of what was just shared. And yeah, wonderful comments coming through YouTube. So shall we move on to a sixth question, Whitney?
I think we could, if you'd like, or we can, I have a little passage I'd like to share, and then I think we could even just continue on here with a couple of the raised hands.
Absolutely.
Okay. I really like this passage on page 26, where Bessel says, Samra taught us that the most human suffering is related to love and loss, and that the job of therapists is, and I would argue all people, is to help people acknowledge, experience, and bear the reality of life with all its pleasures and heartbreak. The greatest source of our suffering are the lies we tell ourselves, he said, urging us to be honest with ourselves about every facet of our experience. He often said that people can never get better without knowing what they know and feeling what they feel. I just thought that was really good.
Thanks, Whitney. You know, one thing that I also think is a really great point about this book, offering hope, is that it's brought us all together today. And there's been some, you know, one panelist made a comment earlier about it being accessible. And we have such a wide group of people joining us today, and we're all together, you know, sharing our thoughts and experiences. And there's really strength in compassion and empathy. And I think that's one great thing about this book, is that it's brought us all together and has really challenged the status quo as far as treating PTSD.
And it looks like, yeah, we can open up kind of to any thoughts about this question, or any thoughts in general that you might want to share. If you want to start with Angeles, I see your hand up raised.
The question I have is, how do we work with tribalism with trauma? I noticed in the book, he observed with the Vietnam veterans creating, like, you're in our group or not in our group. They had to allow him to be part of this. They had to give him some type of medallion, I believe. I can't remember the details, but so he could be part of this group of survivors of veterans. So, and I find that I see that in a lot of other groups. I see that a lot in a lot of media, and I see that a lot of things that are happening now, where people want to identify as a group and you're in or out. And I wonder if, like, trauma just makes it harder for people to connect outside of that, to see beyond that. And is that just a phase in trauma that people are going through collectively, or is that something that is not healthy, or is it healthy at a certain point, and then later as you progress in your healing path, it's something you can see beyond? does that question make sense? I'm not sure.
Yeah. Holly, do you have thoughts on that you'd like to speak to?
Oh, yeah. Look, here's that's powerful too, because some recent neuropsychiatrists, psychologists, as scientists, as you probably know, are saying the need to belong is our most basic need. I mean, Maslow, thank you. But listen up, it's the need to be part of a tribe. It's the need to feel like we have people that have our back. That is one of our most primitive needs. And that is what dysfunctional families use to control people. One of my biggest journeys was to let go of my tribe. And I have let go of my tribe over and over again. As a survivor, I took on the trait of people pleasing and also taking care of other people and not looking at my own needs. When I decided that I needed to take care of myself, I lost a lot of people in my life. I lost that tribe for whom I was caring. But let me go deeper and say, for me to claim my true self, I made a choice to write a book about my life experience. And as I wrote that book, I didn't blame or shame anybody. I just told the truth about my experience. And I knew in writing that book, and I knew in telling the truth, that my family would disown me. And we all need our family. Every time I go on on Facebook, I see people it's like such a standard statement. What matters? Family. What matters? Family. Well, I can tell you as a trauma survivor, dysfunctional, violent, incestuous families are not family. And so this quest to belong to a tribe is, I think, endemic to the issue of recovery and trauma, because what many people get called back to is back to the family. Going back to a troubled family is not healing. Choosing my own family, that's healing. Telling the truth, that's healing. So I think that there is a constant interplay that isn't talked about that much, but needs to be talked about our desire to belong to communities, because communities can be healing. But what if we're part of a community that's dysfunctional, just like our families? We're going to go get sick again. I hope that makes sense. Thanks.
Yeah,
Absolutely.
I think that's a great point too. Like, it's not just any family, it's a tribe or relationships that are safe and that you feel connected to. Yeah, sorry, Brendan, go ahead.
Frederick, you had your hand up.
I'm sorry, I want to comment, but I know this Gail has her hand up, and I don't know if it's okay. Can I pass it on to her? Because I know she has something insightful too.
Of course you can.
All right, thanks.
Thank you, Frederick. Gail, go right ahead.
Thank you, Frederick. I think that there are a lot of things that are hopeful in this book. The fact that he's elevating the conversation, the fact that he's normalizing some things that haven't really been understood or okay to talk about, the fact that he's opening up the possibility of moving beyond the traditional to find ways to heal, that he's opening it up from a whole body, including mind, body, spirit, that we need to take care of. And I would love to just share a story, which very quickly, with the permission of the person who I worked with, who we'll call Julie, just to show you what is possible. Julie came to me one day, and this is not about, don't hear it as me selling services, hear it please as me offering up just expansive ways to think about the ways that we can help other people. She came to me one day, she wanted to do a second session, an equine facilitated session, and her body was just vibrating. She carries a lot of anxiety and dissociates from time to time. So she picked one of the 4 horses that I have to work with. And this guy can be really unpredictable at times. So I brought her to a round pen, did an exercise with her around outside of the round pen to invite her to get as close as she could to her body. Very difficult for her to access her body beyond the chin. But anyway, she tried. And as Echo, the horse, was in the round pen, his behavior started to change. And he was flailing and kicking and rolling. And I started to think to myself, I'm not going to be able to use him with her. But this voice said, just trust the process. So I stopped her. She had her back to him at that point. And I turned her around and I said, Julie, just take a look at Echo. And he was beside himself. And she said, oh my God, that is exactly the way that I feel. Like I am trapped inside my own body and I cannot get out. And the minute that she said that, it was like somebody had injected him with a tranquilizer and he went and calmed down. I finished the exercise with her outside the round pen. She went in, he wrapped himself around her. She didn't say a word to me, but she said it all to him. He never moved the entire time that she was with him. When she came out, she said it was the safest that she has ever felt in her life. So that's the invitation for us to move outside the traditional, to be able to find what are the ways that we can come together as community to help people. He's opened up that possibility. Thank you, Frederick.
Thank you, Gail. That was very profound share. Frederick, did you want to?
Yeah, and I actually think that is such a wonderful way to talk about an invitation or a mirror. I read a lot of books, and I find that what's really fascinating about this book, it demystifies the process. Like, I don't know if anyone was so excited to hear about the neuroscience, the whole part. Like, I didn't realize this work started in the 1990s. I mean, can you imagine? It was just around the corner. And just how he explained the process and the thinking. So much of psychiatry, psychology, mental health, it's all kind of mystified and hokey pokey. I hate to use that term, but it's really very distancing. And I actually found what's hopeful about this book is that you can talk about well-being, you can talk about trauma in ways in which people can relate and can understand. And that it can provide language, but it also provides an invitation to continue to refine the story or refine our knowledge or refine our curiosity around it. And so that's what I think is the tragedy of our current process. Is everything is mystical and like it's so compartmentalized and it's so mysterious. And so I love the clarity and the beauty of the piece. So that's all I want to say. I love it. I'm definitely, it's so worth reading, but I think it challenges a lot of assumptions. And I think that's what some people might be troubled by, because it's taking some long-held beliefs, some long-held practices, it's putting them up for question.
Absolutely. It's really, really challenging the status quo for treatment. Thank you, Frederick. Okay. Whitney.
Yeah, well, thank you all for participating in this, and those panelists who were commenting in the sections or in the comment sections too, have so many great comments I'd like to reflect on, and Christos and Mary and Jennifer and all those who contributed in the comments. Thank you to that too. And if you'd like, in the YouTube channel, if you would just want to check in with us and kind of let us know how you're doing after this session, maybe just another one-word check-in of how you're feeling now. Also, be sure to take care of yourself. Again, just a reminder after this to take some time for yourself. And I will pass it over to Laura with some housekeeping items to go over.
Hi, thank you.
Thank you.
Thank you, Whitney. This was great. Thank you so much, everyone, for attending and for your engagement. It's been wonderful. It's been I've been so pleased with the amount of people that are commenting and just been so exciting. Thank you to this wonderful panel. So just a few housekeeping notes that we'll be meeting next week, same time, 4 to 5:30 p.m. Eastern. And there will be a new YouTube link every week, which will be emailed to you. If you want to be a panelist, there is a questionnaire that you need to fill out. It will be in an email that will come out to you tomorrow. We'll send an email every week with the new YouTube link and that questionnaire. Participation in the panel enrolls you to be selected for the final panel on February 24th, which will be with Bessel van der Kolk. Next week, we're covering part 2 of The Body Keeps the Score, chapters 4 through 6. And lastly, all the book clubs are recorded and they're available in your TRF account under your purchased content. So if you log in, you'll find them there. And so just a little note too, if people had trouble chatting over the live chat, please feel free to reach out to us at TRF and we'll try to troubleshoot that with you, because I know there are a few people that were having a little bit of a challenge. So we're sorry about that. We hope we can help you out. So thank you again, and have a great night. And yeah, thank you.
Thank you so much. See you next week.
Night.